for everybody to understand obesity, the basic starting point is excess fat tissue in the body where it should not be. There are about 200 plus health risks or complications to which excess fat may contribute. Then we look at it. The GLP based therapies, the new kid on the block, the magical treatments, the miracle treatments, these are adjectives commonly used to describe them. Now, these are natural hormones which are produced by the body. It's one of the appetite modulating hormones. And the history of GLP-1 goes back very, very long, from being identified from the saliva of a lizard. I mean, that's where it came from the Gila monster, to now that we're having this session to discuss GLP-1 based therapies. It's a paradigm change and a major advance in research and development. So it's actually the core of the weight management as per right now.
Viewers and listeners, welcome back to the 1MG show. I'm Dr. Rajeev Sharma, Vice President Medical Affairs at Tata 1MG. Today we are going to talk about one of the most pertinent and hot topics of today. Actually, not just today, but since times immemorial: obesity. Did you know 1 in 4 urban Indians suffers from obesity? And obesity is not just about weight, but it's about heart, liver, and overall health. To debunk this, to understand more, I've got with me a very senior doctor, Dr. Jasjeet Wasir, who's director at Medanta, Gurgaon. He's a leading scientific voice and a proponent of digital health. We'll have a great session with him. Dr. Wasir, welcome to the show.
Hi, Dr. Rajiv. Greetings for a pleasant day to you and everybody who's joined us.
Thank you. Dr. Wasir, first of all, a big thanks for coming to our show. We'll dive right into the topic today, which is obesity. And my first question or point of discussion is, what is obesity? What really is obesity?
So if I really need to give you that answer, there are two angles to that. There are two sides of the coin. One is a scientific answer, which is excess adiposity related to a complex metabolic process, which is remitting, relapsing, and has a major impact on health and requires lifelong treatment. Well, if people who are listening to us, they'll listen to this definition, they'll switch off their devices. But for a common man, for everybody to understand obesity, the basic starting point is excess fat tissue in the body where it should not be. It has a major genetic background and a great effect on all possible health parameters, as you mentioned when you started off introducing the topic. Yes, requiring long-term treatment. It's like a journey, it's not a destination. You lose 15 kgs and it's done, or you lose 5 kgs and it's done. And it keeps on coming back when the efforts towards weight loss are stopped. So impact on health, excess fat, and long-term journey would be in the most concise manner how we need to look at obesity from the eyes of a layperson.
Right. And what are the factors that lead to obesity?
So a very common question, the first asked question to me, people who come for weight management at Medanta would be, Doctor, I exercise well and I don't eat too much, still I've gained weight and I'm keeping on gaining weight. What is this happening? But my peers who seem to never exercise and eat everything, they never gain weight. Well, the simplest answer, and it really, you can see the surprise in them when I tell them this fact, that anywhere in between 40 to 70% of excess adipose tissue or fat tissue has a genetic component in that. Now, for further easy understanding, think about a pistol which has a bullet in it. It's harmless. So that bullet is of genetics. You've kept it here on the table, it's harmless. But once you pick it up and pull the trigger, harm will happen. So with a genetic background, a obesogenic environment is what triggers it. Very simply, 5 or 6 things: nutrition, fitness, certain medications, sleep, stress, and at this point of time, one of the biggest contributor to this growing epidemic is the environment or pollution. All of these things, they are not exclusive, they're inclusive, interact with the genetics, and then the final manifestation of excess fat gain, weight gain, all of these things lead to obesity and or its health outcomes.
Right. And especially with the digital world we are in, where we have everything at the tip of our hand, not moving is worsening the cause. Our habits are changing into more sedentary lifestyle. Definitely, that is also a leading cause to contribute to
So
obesity.
very simple thing. As children, our televisions didn't have a remote control. So anybody who wanted to change the channel would have to walk till the television, press the channel or turn the knob. And now it's what? I can see the whole world with the press of a button. Cell phones, all these things. I mean, you want to order food, you don't need to get out of the couch.
Perfect. And uh, recently, we've heard quite a bit about obesity. Not that it's a new topic. People have long suffered from it mentally. There is a lot of stress, especially people whose weight keeps fluctuating. They're constantly bogged down, bothered by the excess weight. From a vanity point of view, and looks have generally, socially been one of the first and major features that people or partners evolutionarily also have seen and kind of backed upon when it comes to choosing partners, right? So how suddenly we have gone to the extent of uh, WHO classifying obesity as a disease, and few parameters on the BMI front. What's your take on that?
So let's first understand the health impact, because you very rightly gave the multiverse of excess weight or obesity. Its health impact is very important to gauge. In your question, you talked about vanity, aesthetics. That's another part of that multiverse, which is very important. So if I really ask myself without pointing a finger, I'm given two options: to lose weight, to look good, or to get health benefits on something which has not happened. Let's be very realistic in this. What will I choose first? My first choice is going to be I want to look good. That's a very core emotion in any human being, is how we look, or a self image, and we look at it every day, and that triggers that mind thing, which is very important part of obesity. Coming to the health impact, very simply, there are about 200 plus health risks or complications to which excess fat may contribute directly or indirectly. Very easily, it's the 4M impact. The first M being metabolic, like diabetes, blood pressure, cholesterol, fatty liver, PCOD, etc. Second being mechanical, knee pain, back pain, acidity, reflux, snoring. These are mechanical aspects of fat causing those problems. The third, very important impact of excess weight or obesity on a human being is the mental aspect. It's rarely reported, and obviously, if it's not reported, the chances it will be assessed are less. And obviously, you don't finally give a solution to that. However, in my practice, I ensure that the mental health aspect is assessed, and if found serious, we get a behavioral therapist on board to take care of that. So things like self esteem, social, personal, professional performance, And as I said earlier, the most core thing, how do I feel about myself? How do I want to look at myself as a body image? So this is the mental impact, and all of these culminate into the fourth M, which is the monetary impact. A very simple thing, buying large chairs, buying large clothes. You go in for an interview, in a competitive interview where multiple people are coming, and there have been research studies done here. It may impact the chances of hiring. It has a direct impact on the kind of payouts or salaries people get. So see the dimensions or the universe of impact on health of excess weight or obesity.
Even medical expenses, because you will end up having some of the other
The
issues.
sum total of the first three M's is going to be going to a specialist, be it an orthopedician, a cardiologist, a hepatologist, and their investigations and the medication. So it's endless, it's infinite.
How does obesity affect various organs? You know, we mentioned a little bit in the beginning, which is heart, liver, but how does it really affect these two and more?
Excellent. So I'll actually stretch that question a little bit in giving you how does excess fat affect the organs. It doesn't spare any organ. So that one thing is very clear. So physiologically, as humans, fat is one of the largest endocrine organ. It's an organ. It's not just a cushion on which I'm sitting. It's an organ, it's active, it produces hormones, it produces chemicals, all those kind of things to maintain the body's metabolism. It contributes to that. When present in physiological sites, as it should be, as the creator has made it to be, it works towards perfection, it is perfect. But when excess calorie consumption happens, first the fat cells will become larger, then they start multiplying, and from their natural sites, they spill over into the organs. So that fat in physiological spaces is nascent, it's doing its job, but when it reaches in places it shouldn't be, like you said the liver, you said the heart, I talk about all the organs, the intra-abdominal fat you would have heard about, there it becomes a terrorist. It becomes metabolically volatile. It produces a lot of neurochemicals, pro-inflammatory markers, the cytokines, the TNF alphas, the interleukins, all of these. So downstream, then all these organs are exposed to this pro-inflammatory milieu or the pro-oxidative state, and that's where the damages are happening to the heart, to the liver, to the kidney, all organs, virtually all organs.
Right. What is the new story now? You know, we have this hormonal story that is kind of unraveling itself with GLP-1s and other newer hormonal molecules that have come out. Uh, Please tell us more about it.
So again, I'll twist your question a little bit. The word hormone and obesity is a trap. So one part of it is the latter part of your question, which talks about GLP-1 therapies, which is the treatment part of it, which is produced endogenously. I'll come back to that. The other is as a causation of obesity. Now, very commonly, as driven by media, social media, general discussions among peers, social groups, it is presumed that most of obesity is driven by hormones, and the most common of them being thyroid. We may not be able to explain that mystery or myth in this program, but let me tell you, if you say thyroid is the major hormone cause for obesity, you're like looking for a needle, not in a haystack, but in an ocean. You're not going to find it. So things like that. That's the one hormone part of it. Yes, they do contribute, but as a cause and effect relationship, it's not as strong as we really talk about. There are specific hormone disorders which are related to excess weight, needs to be assessed if found possible, because by their physical characteristics, then we look at that. Coming to the second half of your question, the GLP based therapies, the new kid on the block, the magical treatments, the miracle treatments, the game-changing treatment, these are adjectives commonly used to describe them. Now, these are natural hormones which are produced by the body, in glucose homeostasis, in energy intake, metabolism, you name it. It has a relationship, far-fledged relationship with almost, again, all organs, because they have receptors for the GLP-1. Simple thing, the appetite. It's one of the appetite modulating hormones. And the history of GLP-1 goes back very, very long. In fact, in my professional career, for the last 15 years, we've been prescribing these therapies. And it's had from being identified from the saliva of a lizard. I mean, that's where it came from the Gila monster, to now that we're having this session to discuss GLP-1 based therapies. It's a paradigm change and a major advance in research and development. So it's actually the core of the weight management as per right now. To finally answer the question, it's the core as a solution for weight management for those who actually medically require it. There's a vanity part of that. We'll talk more about that, but it's because it's important from our program to sensitize people not to take things in their hands and follow certain misguided things about using them off label. So that is one strong message that we need to share with everybody. Please don't do that. You must consult your healthcare giver. It could be a bariatric physician, an obesity expert, an endocrinologist, or your physician who takes care of weight. So please beware of that. Yeah.
Very important point. What are the various kinds of these GLP-1 category molecules that have come out?
So if we talk about the pharmacology of that, that'll be a little boring. But essentially, from the Gila monster, there is one series of drugs which came out. So it had a exendin-based backbone. And the newer ones we use is more homologous to the human GLP. So these are two lines different in chemical structures, but the ones we use at this point of time are more like what the human body produces. It's over 90% homologous to what your and my body produces. So the immunogenicity and all those of these is pretty much lesser than the other ones. So that's the pharmacology of that. So at this point of time, we have the two common, we call it incretin-based therapies. They may be the GLP-1 like semaglutide, which is available for use as a tablet form or as an injection form for both diabetes. That is, the tablet form is approved only for diabetes, and the injection form, which is approved both for diabetes and weight management. That's pure GLP. Then we have the new kid on the block, which is tirzepatide. It's a dual agent, very interesting novelty of research, that the single molecule attaches itself to these two receptors, the GIP and the GLP. So we call it a dual agonist. That's tirzepatide. So these are the two commercially available molecules approved either for diabetes or diabetes, obesity, or just obesity.
Got it. And I was reading somewhere that semaglutide has also been proven to be cardio protective or is helping cardiac health. Is it? And could you throw more light in terms of what studies are happening? What is it really? Other than diabetes, you said use cases for these molecules.
So if I was prescribing a GLP based therapy to you, you know what I would have told you? I would have said, and you didn't have diabetes, you've come for weight management. What I would have told you that after explaining everything, the health impact of obesity, I would have said this drug is at this point of time one of the most effective treatments available for fat loss or weight loss or for obesity, with scientifically proven in well-designed trials of heart, liver, kidney, and brain protection, with ongoing indications in the field of de-addictions also. Not that we are prescribing it, But in alcohol dependence, in tobacco cessation, these molecules have showed their definite benefits. And semaglutide very recently has got an approval in fatty liver disease. We had data about this cardioprotection, which has already come up, the kidney protection, the ongoing trials for neurodegenerative diseases are on. So these incretin-based therapies, be it the GLP-1 or the dual, with lot of proven data and lot of emerging data or ongoing trials on organ protection is very, very exciting for us metabolic physicians.
Right. Are there any side effects that have been found out for these molecules?
Okay, so you want a media answer or you want the common side effects?
As a doctor.
Okay. Yeah. So it's a very common scenario, at times I make it a practice rule to ensure that the side effect profile is told to the patients. All my patients undergo a safety screening. We'll talk more about that. But essentially, the most common side effects of these group of drugs, be it a semaglutide or tirzepatide, are gastrointestinal tract related. It could be upper gastrointestinal, like nausea, vomiting, and rarely the lower GI side effects like diarrhea and constipation. This is what generally people would be experiencing when they're on this drug. One thing which may be, when exaggerated, may be perceived as a side effect is loss of appetite, because habitually we're used to eating, and that eating is usually that hedonic hunger, like samosa kha lo and burger kha lo, pizza kha lo. The first drastic thing which patients experience on these drugs, that their liking or their love for calorie dense food goes down majorly. And a very easy way of understanding that what people may experience is that food noise disappears. Suddenly, you see a calorie dense food in front of you, it won't generate that wanting to eat or liking to eat. Then food will become nutrition. So these were the common kind of side effects, which according to me should be mandatory. All people on these drugs, obviously these drugs need to be prescribed by somebody who's an expert in that field, should not be done off label. This I'm repeating because it's commonly happening. We need to protect people from these things. So one was those common side effects. The other part, there are four. In my practice, I use four important things to be assessed, to be addressed, and the drug not to be started when these are there. One, any past history of pancreatitis or any pancreatic disease or pancreatic cancers. Second, you may call it a overkill, but the studies on these drugs showed increased occurrence of gallbladder stones. I do screen people who I start these drugs with ultrasound to look for gallbladder stones. Third is thyroid cancers. That's a major concern, whether you read the label or you go to the media, social media, thyroid cancers, and that is a specific kind of cancers seen more in the rodent model. But again, we need to be aware of that. Any history of those kind of thyroid cancers, family history, needs to be taken care of. And there's been a lot of noise about eye involvement, optic nerve, retina involvement. Screening of the retina and any history of such eye disorders is needed. I do it for all my patients, and I would like everybody else who's joined in with us to raise a question about safety concerns with their health caregivers. It goes a long way in ensuring you have a safe journey on these drugs.
Perfect. So bottom line is, consult your doctor not once, twice, but however many times you need to, and that will keep you safe.
Absolutely. Safety. First dictum in medicine is cause no harm. Benefits will definitely follow after.
Perfect. And how are these molecules getting administered? Because you said oral and injection. I saw there was a very fancy pen that could be very easily administered, and it looked like a toy. But how are these administered?
So yeah, you rightly said that these medications, be it semaglutide or tirzepatide, come as injection forms. There are various doses We start at the lowest dose, and based on the patient's response, their weight loss, their metabolic benefits, we gradually increase the doses. It's like what people usually know as insulin injection pens. These are very elegant, easy to use, do-it-yourself devices which have metered doses in it. So as a ease of injection, it's there. With the ease of navigating through the pen, it's very easy. The storage, all these devices usually come as 4 doses in a single pen. So one pen on an average with any dose would last for a month. The titration schedules vary from patient to patient, but they need to be individualized. But essentially, it's an easy to use pen device housing 4 doses, whichever dose you choose to give to the patient or the patient is on.
Got it. Next part of this discussion, I want to touch upon your personal experiences with these molecules and more when it comes to obesity care programs, let's say. So one part is the medicated part of the program, but like you said, there is sometimes nausea and some sort of upset stomach that may be. Do you also advise your patients some adjunctive advices to eat certain things or not, or some lifestyle changes that they should observe?
Absolutely. So anyway, one very important thing which happens with these drugs is the appetite goes down. We must not forget that it's not only quantum of weight loss we're looking at. As a healthcare giver, to me, it's the health of the patient, person who's come to me for weight management. It's their overall wellness we look at, of which nutrition is a very important part. If you're just not eating, you're curbing nutrition, you're not giving your body what it needs. So we need to work on the nutrition part. Then the word diet changes to nutrition. Give your body what it needs for becoming better in your health and for attaining the best wellness. Muscle health is extremely important a part of while prescribing these medications. So going just beyond those medications, we need to dwell on the nutrition, on the fitness part to ensure that they get the maximum out of these prescribed drugs.
Right. One question, when it comes to prescribing these drugs and when a patient takes them, let's say if a patient was already on diabetes, anti-diabetic medication, was a diabetic, or other medicines for hypertension and others, is there a protocol or a plan that you observe so that the effects of various medicines in terms of a clinical protocol are kind of complemented, and there is better effect for the health of the patient?
Absolutely. So, again, that finger show is there. Safe, effective, durable weight loss, excellent effect on blood sugar control, benefit on blood pressure, some effect on their lipid profiles, heart, liver, kidney, and brain protection would be a consorted benefit. Now, this is conceptual and based on trials. Now, let me tell you what is happening since we've been prescribing these drugs. Now, it's been nearing 5 years since the oral tablet and few months since the injectables have been available for clinical use. You will not believe it. Every day, especially patients with diabetes and obesity, they're coming back, their medications are going down, and a lot of them are achieving what we call as pharmacological remission of diabetes. Their A1Cs are going less than 6.5, less than 5.7. Their ongoing anti-diabetic medications are discontinued. We had never seen that earlier. So then when somebody comes and tells me, doctor, this has happened, I think this is a miracle. I would say accept what they're saying about these drugs. They are so powerful. Weight loss of 20%, 30%. So if you ask a benchmark of weight loss, it ranges anywhere in between 10 to 25%, which just with lifestyle is like mission impossible. So these are the kind of benefits. Fatty liver. So very recently, this patient of mine came back who started with with a liver elastography report indicating that fibrosis levels are in between 2 to 3, which is pretty significant. And after about a year and a half of being on semaglutide, their liver fat seems to have disappeared. It's like a rock has become cotton. And that's how I actually explained it to her. This is what has happened. And we have clinical trials onto that saying that, oh, there would be a major benefit in these. That translating into a clinical benefit documented is very gratifying for me as a physician. And obviously, you can't believe it how patients feel.
So good to know. And what we are not, if not helping.
Oh, yes, 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 yes.
Perfect. So, how do you see, this paradigm shift shaping up the future of obesity care management in India and globally also?
So, see, we're talking lots about pharmacotherapy, drugs, this, that, but let's not forget that medications is a part of it. If you really ask me if we need to deliver the highest level of health or wellness through weight management or obesity care, it has to be a multi-pronged approach where we have to have a nutrition coach, a fitness expert, a bariatric physician, an expert in cognitive behavioral therapy, a gastroenterologist who is an expert in medical weight loss devices, and in the extreme cases, a bariatric surgeon. This I call as the A team. Once all these services are there, obviously lab services, radiology, all these services are there under one roof, you can say you're delivering the best level of care. We should not just focus on medications because it goes much beyond that. Just to give you a simple example, that if anybody loses like 20% of their weight, I said weight, I didn't say fat. So out of that 20%, a significant amount of muscle loss is happening. Your overall health is determined on less fat and more muscle. If you lose muscle, there is a question mark, are you really getting that metabolic benefit? That's where the nutrition, the fitness will come in to preserve the muscle health, which happens with normal weight loss regimens, including medications. So that's a word of caution. It has to be a consorted, multi-pronged approach to give the best wellness.
Got it. So, maybe to summarize, if I have to say, obesity is not just about looks, more weight, but more deep into the biology of things, and we need to treat it more as a disease as the times are calling out, and not just manage the condition, but maybe have a balance between the two, and with that we can hopefully cater to this pandemic, like diabetes and hypertension, pretty much obesity also leading to both of them, and a mishmash of interdependence between the three and more metabolic conditions, right?
Yeah, I'll just add on to that. Obesity is not about, is just about how heavy one weighs. It's about how heavy the impact of that excess fat is on a person's health. The 4 M's we talked about. How strong is the impact on the metabolic, mechanical, mental, and the monetary health of a person? That's the simplest way to look at excess fat or obesity.
Thank you so much, Doctor. I think this is very helpful. We'll go into the last bit of our session where I'm going to pose some very frequently asked questions so we can summarize them. And I think we've kind of covered quite a few of them, but I'll just shoot. So, the commonly asked questions that patients also, often, think about, is this treatment safe in the long run?
Yes, it is safe. However, we are limited to the number of years that these medications underwent those clinical trials, which may be a few years. On top of that, once they are launched for clinical usage, we keep on adding the years of safety. But if you ask me this question, is this medication safe for 10 years? I don't have the evidence, but going back in time for about a decade and a half, incretin-based therapies or GLP-based therapies have been there, and we've not seen any major health concerns till now. So we hope things are going to get safer, more effective, and better in the time to come. Yeah, safety is a thumbs up.
Perfect. What happens if I stop the injections? Will I regain weight?
So both semaglutide and tirzepatide, their trial programs raised this question. So somewhere through the trial, they divided the patients into two groups. One, you continue the drug or you give a sham. So those in whom the drug was discontinued, weight gain happened. Weight will always come back. So it's a journey. You have to be at it for a long term.
Sure. Is this only for the wealthy, or will it become affordable in India?
Well, given a chance, I'll make it super affordable so everybody who deserves gets a chance with these drugs. I believe in the future we're looking at easier options which are easier on the pocket. Yeah.
Perfect. Thank you, Dr. Wasir. This has been a fantastic session, and we've learned so much about newer therapies, newer regimes, newer protocols, as well as the goods and slight bits of bads, because we have to make trade-offs as doctors to define treatments, to treat patients, and most importantly, keep them safe, healthy, and fit. So, thanks for joining us for the session. Thanks for your time, and I'm very sure our audience have taken a lot away from this session.
Oh, it was really amazing sharing the as a healthcare giver, as an obesity expert, a part which would hopefully guide a lot of people in the right direction. Again, repeating, in the right direction, so that they are able to lose their weight, gain their health, and achieve the best wellness possible. So, good luck to all of you.
Thank you, Doctor. Thanks, everyone, for keeping tuned in. I hope this session was informative for you. Stay tuned for more. Stay healthy, stay fit.